All right, treatment. Well, first of all, let's talk about the generalities of treatment. What's good treatment? What is appropriate treatment? This is my rendition. I take full responsibility for what I list here. But number one, it should be predictable. Number two, clinically effective. Number three, cost effective. And number four, safe. I don't care what kind of treatment you're doing, whether you're using medication, pills, whether you're doing surgery, whether you're doing chiropractic, whether you're doing voodoo. If you have all four of these characteristics, I think you'll probably be doing pretty good treatment. I've made that into a sentence, and so here's what my sentence says about what is good treatment or conservative treatment. That treatment which is predictably effective without placing the patient under more cost and risk than is necessary. So, I have developed that splint. I gave you the story of how I developed that device and used it now over 1,000 times on patients. It's a very simple device. It sits in the roof of the mouth, right behind the upper front teeth. It works in a very simple way, and that is it separates the back teeth. That's how this device works. After studying its effectiveness and then finding out how it worked through inductive reasoning rather than deductive reasoning, it was obvious that the way this worked is that it kept the back teeth apart, and 90% of the loads on the joint come through the back teeth only. So what this device does, it separates the back teeth, no more, no less. Just like the First Lady said, if I take a pencil eraser and gently put it between my two front teeth, and what she didn't say is separate the back teeth, it feels better. So that's what this device does. And after 1,000 cases, I have seen extremely good results with my latest study showing that within the first 3 weeks, 70% of the symptoms are gone on the average. This is average now. At 2 months, 86% of the symptoms are gone on average. At 4 months, 96% of the symptoms are gone. And at 6 months, 98% of the symptoms are reduced. That's a picture of the device off the model, and it's a very simple device. To get it, you have to take impressions of the teeth, and goes to the lab. The lab takes about a week to make this device, and then it is brought back to the practitioner's office, placed in the mouth, and then a series of protocols are used, very simple protocol. The protocol includes using the device 24/7 for about 9 weeks. At 9 weeks, then the patient's usually ready to go to nighttime only with the device. I follow the patients along for another couple months, making sure they're stable and they don't backslide. And then at around 6 months after beginning treatment, I tell the patient, come on back if you ever have any more trouble. And the only people who come back are the people who either lose or break or let the dog chew up the device, which is actually fairly common when they don't put it in the little case we give them.